Very good morning to all my dears. We had completed the introductory portion of CS stomach about its cause, then pathology, then pathogenesis, and today we are going to discuss about the clinical presentation of or clinical manifestation of or symptoms of a patient who had CS stomach. First of all, let me remind you that whatever may be the symptoms basically depend on about the site of pathology, size of pathology, and morphological peculiarity of stomach. So the clinical presentation depends on seat of CA, size of CA, and morphological peculiarities. And more than that, especially in early period of life, cancer may not have any symptom. And in a moderate level, even though our patient may having symptoms, the symptoms are very vague or non-specific. In such condition, we can see the symptoms of AAA. That means our patient will have a constant complaint of anorexia, anemia, and asthenia. A new symptom of dyspepsia or new symptom of anorexia or great prostration with a rapid sinking of vital force and asthenia, unexplained weakness, unexplained weight loss, unexplained lack of power. All these symptoms are, we may note down only as prostration. But actually, on seeing a patient with a cancer, we named the status of our patient as a cachexia look. That means very dry, very weak, very exhausted, very emaciated, very tired. Why our patient is having a look of cachexia? Because here tumor cells diverts a disproportionate amount of nutrients from different parts of our body for the growth of the tumor. Automatically, our patient become very weak. He cannot use the metabolites or metabolic products for the general well-being or general growth of his body. That is why the tumor diverts disproportionate amount of. That is why our patient is having something like that symptom of severe asthenia, severe anemia, and next about most common symptom of gastric carcinoma as upper abdominal discomfort or pain. The pain may be very vague, very non-specific, or very mild also. And along with that, new onset of dyspepsia or nausea. That means whenever the patient wants to have the food, he may having a sense of nausea. And next about the intolerance. As in case of our hepatic issue or a gallbladder issue, or patient may having a symptom of intolerance of a certain food, especially the fatty food. Here you can see the sudden intolerance of certain food, especially the red meat, because it's an adaptive mechanism of our body, because our body knows that the body cannot digest or absorb or transport the same. That is why, because already the stomach is very weak, and in metaplastic or dysplastic changes, the stomach knows that it cannot digest the meat like a very fatty food. That is why automatically it's an adaptive mechanism. The body cannot tolerate the fatty food, and unexplained weight loss is there. That means if our patient is having a proper digestion is needed, proper absorption is needed, proper transportation and nutrition is needed, Everything is totally displaced, disturbed in CS stomach. That is why he cannot absorb the nutrients and he cannot grow well, and automatically unexplained weight loss is the one of the main symptom of our patient. Unexplained weight loss. And hematemesis or melena may be the first symptom. Just see what actually happened in hematemesis or melena. You know that now you know that our CA spread from the mucosa as carcinoma in situ, from mucosa to submucosa or submucosa to muscularis or muscularis to serosa, something like that. While spreading the cancer or spreading the malignancy or the neoplasm, it also damaged the blood vessels also. So broken blood vessels may leads to mild or moderate bleeding, especially in upper gastrointestinal tract. In such condition, the patient may having the symptoms of, at first phase, the patient may not mind about or the patient may not know about the internal bleeding. Automatically, a slow and progressive bleeding will leads to weakness, anemia. Okay, and in next phase, when the medium-sized blood vessel is getting broken, and the same may leads to collection of blood in the stomach. In such condition, the patient may, first of all, the first symptom of our patient may be as hematemesis, that is vomiting of blood. And next symptom is about the melena. Melena is nothing but the digested blood in the stool. That means the PC or the observation of the patient may be as the stool is very brownish or blackish or very anemic stool. That means occult presence of occult blood in stool, as in case of peptic ulcer disease. Because the disintegration of the RBC and liberation of hemoglobin and hemoglobin combines with the acid and thereby acid hematine is formed. That is why in such condition our patient is may having the hematemesis and melena may be the first symptom of our patient. Patient may not have any other symptom. And like that, next PC is EC satiety or early satiety. That means immediately after having few mouthfuls or 2 or 3 mouthfuls, our patient will have a sense of fullness. That means the stomach is getting full. Automatically, the patient lost to have the food in proper quantity, the patient become very weak. The early satiety or EC satiety may be because of the achlorhydria in CS stomach or due to, as in case of intestinal variety of carcinoma, you know that the fibrosis and cicatrization, calcification, everything that leads to stomach will be converted into a very fibrotic, contracted, corrugated organ. Due to that the stomach lost its quality to relax or distance in a properly due to the lack of elasticity of the muscles of the stomach, and automatically the stomach will be automatically very a small contracted organ. So automatically our patient will have the symptom of early satiety and insidious upper abdominal discomfort and waist postprandial fullness with. You can see a very small stomach due to the growth of cancer in or a tumor in the either it may be in the pylorus of the or the fundus or in the body or anywhere, but mostly the tumor may be in the pyloric region of. Automatically the same will leads to incomplete or complete obstruction or a gastric outlet obstruction may be the combly, and automatically immediately after having the food the patient will feel some abdominal discomfort especially after food. That is the symptom of abdominal discomfort and vague postprandial fullness. And next about the epigastric discomfort or fullness and burning after each meal or belching. Here you can see the symptoms like that of peptic ulcer disease. All these issues are because of the growth of the tumor. And here one of the peculiarity of the pain of CA stomach. That means in peptic ulcer patient, you can see the modality of pain in relation with the food intake or not. But here you can see the pain is very constant. If our patient is having a constant abdominal pain, not inconsistent with the relation with the food, and usually it may be due to CA. So epigastric pain, which is constant or consistent, which may indicate the location of the site of the tumor. And let us see. First of all, we mentioned about the depending on the site, the growth of the tumor or the growth of the carcinoma may be in the lower end of the esophagus, or in the body, or in the fundus, or in the gastric antrum. In such condition, here you can see when the CA affects the cardiac portion of the lower end of the esophagus or in the stomach, dysphagia, the patient cannot have the food, and especially to the solute. If he wants to swallow the food, he must have the added increased amount of water is needed to swallow. So swallowing become very progressively very difficult, and along with that the signs and symptoms of gastroesophageal reflux disease, that means acid regurgitations. So if the CA affects the cardia, usually our patient will have the symptom of difficulty in swallowing, that is dysphagia, especially to the solid. And as the pathology advanced, the liquid food also having very difficult to. So, and sensation as if the food is stuck in the throat, that we explained. That means it's very difficult to swallow the food. And when it affects the pyloric region, that means the dysphagia is affected, as can be seen in cardiac involvement, and when it affects the pylorus, you can see our patient will have the signs and symptoms of retention type of vomiting. That means the vomitus may contain near about 6 to 24 hours or 1 or 2 days food. That means the signs and symptoms of pyloric stenosis or retention type of vomiting, and nausea and vomiting appears when the patient starts eating, and it's one of the very important symptoms. That means whenever the patient wants to have the food, the patient will have the sense of vomiting, because the patient cannot have, already the stomach is filled by the carcinomatous growth. Automatically our patient will have the symptom of nausea and vomiting, and there may be some colonic symptoms like alternated diarrhea and constipation, or changes in bowel habits. Let us have a look about the topography of the gastric cancer. Mostly the most probably the gastric carcinoma can be seen at the pyloric area. That is why the patient will have the symptom of nausea and vomiting, and cardia may involve only 10%, and like that fundus and body only 10%, and lesser curvature 25% of the gastric antrum, 25%, and 3 to 5% only with a greater curvature. These are the possibility, or mostly you can see the 50% of the gastric carcinoma starts in the pyloric region, or that is why the patient will have signs and symptoms of gastric outlet obstruction or pyloric stenosis, and thereby retention type of vomiting is there. Okay. You see, it is the polypoid gastric cancer, that is adenocarcinoma, adenomatous polyposis. Here you can see the carcinous growth is like that of a small polyps. It is a endoscopic view of the gastric cancer, and here in some time the patient may having that symptom of satiety with loss of, as the patient cannot have the food, automatically he will lose the weight also. And next about the symptom of metastasis. As you know, the CA, it is spread into direct spread, indirect spread, then lymphatic and hematogenous spread. And when it spread to the distant area of our body, and the same may leads to some complication with the hepatic function, and thereby ascites or jaundice, and pathological fracture may be that means easy brittleness of the bones, and signs and symptoms of acute abdomen. When the ulcer perforates, perforation of gastric CA may be the first symptom without any other symptom. The Perforation may leads to acute abdomen-like condition and severe abdominal pain with vomiting, and in such condition, it may be the first symptom of our patient. And if there is internal bleeding, upper GI bleeding that we already mentioned with anemia and progressive fatigueness, and it may spread to the small intestine and thereby partial and as the pathology advances or when the carcinoma spread to the descending portion of the duodenum or into the small intestine, and the same may leads to complete or incomplete intestinal obstruction. And peritoneal dissemination, that means that the CA can be spread into the lymphatic system or into the bloodstream and outside the stomach, and may the same may affects the neighboring viscera, that is the mostly the liver or pancreas or other internal organs. And usually, as we mentioned earlier, this cancer is often diagnosed when it is already too advanced. These are the, it is gastric rugae, carcinomatous, ulcerative type of carcinoma. Okay. And in some of our patient, you can see some lymphatic extension to the supraclavicular or perilimbical, periumbilical and left axillary. We can discuss it in later. And palpable tumor mass and ascites, palpable liver mass and occult gastrointestinal bleeding and anemia. We can discuss. So these are the common presentation of a patient with a carcinoma. So the symptoms are depending on the site and size of the tumor, and when it affects the uh, cardia, usually swallowing will be difficult, and when it affects the pyloric, usually the retention type of vomiting, and as the pathology advances, the patient will have the signs and sorry. ഹലോ, ഞാൻ കോളേജിലേക്ക് പോവുക, കുഴപ്പമില്ല. ആ പോവുക കേട്ടോ, വൈകിട്ടാണ്. Okay, so there may be, your patient may be very cachexic, anemic, asthenic with great weakness, and there may be persistent abdominal pain with signs and symptoms of metastasis can be seen, and hematemesis melena. These are the main cardinal symptom or the main symptoms or red line symptom of a patient with a CS stomach. Thank you very much.